When a recent case of COVID left Berni Wood struggling to breathe, she called for help. And while the ambulance was there within minutes, she says she was told the wait to see a doctor would be hours.
I was told, well, the wait is going to be 16 to 20 hours or longer. And I'm like, oh my God.
Those eye-popping wait times aren't out of the ordinary at Charlottetown's largest hospital. At least 15% of PEI residents don't have a family physician, sometimes leaving them with no other option outside the ER. And closures or reduced hours at some of the province's smaller rural hospitals make the wait times at those that are open even longer.
Our issue with this has entirely been related to staffing.
The problem is pan-Canadian. Frontline staff are leaving in droves, and replacing them in a timely manner has become impossible. During the summer, vacations and sick calls have stretched staffing levels to dangerously low numbers. In New Brunswick this summer, health authorities say 3 patients died in the emergency room waiting for care. 6 ERs in Quebec, including one in Montreal, temporarily closed in July, and there were closures and reductions in Alberta, Saskatchewan, Nova Scotia, Newfoundland and Labrador, and all 3 territories. On the West Coast, Ashcroft, BC's emergency room has closed continuously, and 2 residents who live nearby died. Kamloops, about an hour away, is the nearest medical facility. And while the doors of this hospital outside Ottawa and Perth are back open after multiple shutdowns, hospital CEO Michael Cohen says staffing is still too thin.
The reality is that there's more positions open now than we have nurses and frontline workers.
Agency staff has become a pricey stopgap, and one Cohen says isn't sustainable with the busiest time for hospitals, cold and flu season, around the corner.
We're very concerned about the fall. We have vacant positions that unfortunately we're not getting any applicants for. So we can continue on with agency staffing, but the reality is that agency staffing is not a permanent solution.
Even big city budgets are feeling the pressure. At Canada's largest research hospital in Toronto, agency costs have skyrocketed.
We've normally seen about $750,000 to $1.1 million annually in agency costs. In the last year, that's about $7 million.
That's over a 500% increase. And while unit closures aren't as common in city centers, there is concern the mass exodus has put even more pressure on staff left behind. The impact? An erosion of patient care.
Sometimes when there is some personnel missing, it can be up to 6 patients for 1 nurse. That's very worrisome because this is a specialized care hospital.
At 63, Wood is worried about aging inside such a strained system.
It's going to get worse and worse.
Unsure what kind of care she can expect the next time she needs it. Jamie Muraucher, Global News, Toronto.